Dr. Fauci, today you will be receiving a very important award. The name of the award is Res Publica. As all our ancestors used to say, there's no greatest honor than to serve the community, Res Publica. This is something that for all of us who pride ourselves to be civil servants is a great honor, and you're really one of us, and we want to pay tribute to you. Given your outstanding background, it is no wonder so that you have become such a highly respected public figure throughout the world. And I can tell you that on behalf of all my fellow Italians, for what we have been doing under these difficult circumstances, grazie. Today, it is another important day, a very important award you will be receiving in a few moments. I want to tell you that for all of us who really pride ourselves to be Italians, you are really a source of inspiration, and through your daily activities and to what you're doing also to inspire the work of many other researchers and fellow Italians in the NIH and the different institutes working to promote science in this country. This is something that really resonates a lot in my country.
Well, right now, even though I very gratefully accept this award of Res Publica, that we have a lot of work ahead of us, because even as I speak right now, yesterday, we had 83,000 cases in the United States, which is the most we've ever had on a single day, even at the very worst part of the outbreak. And if you look at the map of the European Union and Italy and France and Spain and the UK, the same thing is happening there. They're having a resurgence of cases. So we have a challenge ahead of us, and I think it reminds us that this is a global problem that we have to pull together globally, because one area of the world inevitably affects another area of the world. So hopefully, as we enter into this very precarious time of the cooler months of the fall and the colder months of the winter, that in fact we abide by the public health measures that we seem to have been ignoring for so long, both here in the United States and elsewhere. So again, thank you very much for this extraordinary honor. I am very, very pleased and very humbled by it, and I pledge to you that I, at least in my own efforts and those of my colleagues, will not really slow down at all until we get this under control. And as you well know, with the Italy connection, we have so many people in the NIH who are Italian scientists who are also working on this effort, including Christina and Paolo and Patricia and others. As you know, I have trained over the years many, many Italian scientists, and even now as I speak, they are battling COVID-19 in cities like Milano and Venice and places like that. Sometimes, unfortunately, when you look at the various proposals of how to address this outbreak, it inappropriately pits the economy against public health. And that's completely distorted because, as I've said very often, we need to open the economy both here in the United States and in Europe and throughout the world, including in Italy. But we should look at public health measures not as an obstacle to opening up the economy, but as a safe and prudent gateway and vehicle and direction to open the economy. So when you have this black and white yes or no, the extremes don't make sense. It isn't either lock down the economy or do everything you want to do and don't worry about public health. It's to open up the economy in a very safe, prudent way at the same time that you practice good public health measures, like I've been talking about now for many months: wearing of masks, keeping distance, avoiding congregate settings in crowds, doing things outdoors as opposed to indoors. That's what's important right now.
Thank you.
Thank you.